As people age, there are predictable changes that happen to our bodies, and most of it can be well managed through physical therapy. I spoke to Salter Health physical therapist Jen Bax to get the details. Jen, great to see you, and help us understand what are the most common physical issues you see as a person starts to age.
Yeah, so a lot of the normal kind of biological, physiological processes that happen as our bodies mature are decreased strength of bones, loss of muscle mass, loss of protective cartilage in our joints, and in general, decreased water content in our tendons and tissues. And the progression of these is kind of dependent on various factors, previous level of activity, genetics, all sorts of different things. Oftentimes these changes are associated with diagnoses that are given by physicians. So a lot of people have heard osteoarthritis, osteoporosis, degenerative disc or degenerative joint pathology. And then in physical therapy, we typically see more of the effects of these processes that are happening physically. So we typically see patients for issues related to joint pain, difficulty moving or walking, balance issues, or even injuries to those tissues, the muscles, tendons, and bones.
And is there a way for us to slow the process and prevent injury?
Yeah, so while we can't stop any normal biological or physiological processes, we can certainly limit the potential detrimental effects on everyday function or quality of life that sometimes come along with the aging process. First and foremost, just staying active. So we have some funny sayings in PT: movement is medicine, sitting is the new smoking. So really just maintaining a healthy lifestyle and weight throughout the age spectrum. So starting at an early time frame and kind of maintaining that good, healthy lifestyle throughout. Maintaining good joint mobility and range of motion is important. As our tissues lose that water content, they become stiff and we lose our ability to move, which may limit our ability to do certain things in our daily life. One of the biggest things is strengthening exercises. So to help maintain that muscle mass, it also helps to strengthen bones and protect our joints. And it can also limit falls, which are a huge problem for an aging population. So having strong muscles, and that doesn't have to be your typical weightlifting. It can be just using resistance bands or body weight exercises or something that's taxing to our muscles that can help with those strengthening. The other big thing is incorporating balance exercises into daily life.
I like that. That's great advice. And I imagine aches and pains are, possibly expected as you age, but what are the red flags? What's the big sign that you should go see a physical therapist?
When those aches and pains limit your ability to do your normal daily life, it's probably time to get some professional advice or seek some advice. So when you can't do what your normal daily activities are or what you would normally be expected to do, that's when it's time to see someone.
Okay, and do you need to be referred though by your physician?
You do not. We can see everyone direct access. Some of it's dependent on insurance. So having a point of contact is super helpful for us. If you have a primary care or another provider that you're in regular contact, that is helpful to have, but we don't need a referral directly.
And quickly, what can someone expect when they go see a physical therapist?
Yep, so your physical therapist will do a thorough evaluation on your first visit and kind of determine what your needs are. And first and foremost, whether it's appropriate to see a physical therapist or if we need to refer you on to something else. They'll gather that information together. You'll make a plan going forward and you'll be involved in the process through the whole thing. We'll come up with some exercises for you to work on at home. Sometimes it requires some more hands-on visits and follow-up, but that's totally dependent on the individual.
And Jen, where can people go to learn more?
You can go to salterhealth.com. Another good resource is choosept.com for anything related to physical therapy.